We are a union of public employees, of nurses and healthcare, higher education, of pre-K through 12. And most of the time on this stage, we talk about K-12. And you see today, we've been really intentional about talking about and making sure all of our members are seen. And today, yes, what we have here is a panel on healthcare. And I'm going to introduce January Belcher, Joel Hernandez, and John Brady. But about a decade ago, sorry, I'll take my mask off, we passed a resolution on creating a healthcare system, and you just heard from our wonderful speaker, a healthcare system that puts patients over profits. And in the last convention, we passed a resolution about creating a healthcare system that works for all. And we all know it's broken. And today, between our speaker, between Claudia and this panel, we really want to continue the conversation about what we need to do, particularly on the issues we're facing right now. Issues like workforce sufficiency, retention, pipeline, working conditions, staffing, violence, fatigue, and mental health. Healthcare workers are facing all of that. So these three folks work every single day in healthcare. And I want to see if we can really hear from them what is going on right now. So January Belcher is an RN from the Ohio State University, IO, and the Wexner Medical Center. Joel Hernandez is a nurse, an RN from St. Charles Medical Center in Bend, Oregon, and I remember meeting you in Bend. And John Brady, who many of you know, is an RN from AFT, Connecticut, and the head of our PPC, our RN PPC. So, and if you want, so let me just ask, people are leaving the health professions in record numbers. This includes newly trained nurses who leave the profession in the first 5 years. It also includes so many of our PTs, OTs, respiratory therapists who also leave. And there is a huge crisis in the pipeline, too. So, how do we deal with retention?
Are you directing that for me?
I'm directing it. I'm going to start with January. Yeah.
All right. For retention, the first and foremost thing is the CEOs and the powers that be, leadership, need to recognize how valuable our experience is. They need to acknowledge that you can't function without the experience and the skill set of the people that have been there forever. Schools can teach you so much. Clinical experiences, fantastic. But the real world, textbook, and bedside are two completely different things. And the things that you learn from older nurses like myself and so many others that I work with is invaluable, and some things you won't find in the textbook. So you need to take care of the people that are there, the people that gave their blood, sweat, and tears to make that organization flow. You have to pay them. You have to pay them what they're worth. We shouldn't be living paycheck to paycheck. None of us should. Whatever profession that you're in, you never should have to live paycheck to paycheck. You need to give the money. You're making billions of dollars. You have the audacity to have $250,000 bonuses given to your CEOs, but yet you want to have your staff struggle. It makes no sense. So you need to reinvest that money into the proper channels. Give us the money, give us the benefits that we deserve, make our environment safe, make the ratios safe for patients so we can deliver excellent care. And honestly, if you want people to come in, there is money out there that you can, again, maybe take away some from our military that we're not using and put it back into grants and funds. Let teachers go to, people that want to become educators, people that want to become nurses, go into the medical field, let them go to school for free.
Yeah.
I was like, there's a way to make that happen.
Like the GI Bill.
Like the GI Bill. Attract people to our professions, because these are the professions that are struggling.
Yep.
So show us the money.
And I'm going to go to Joel next in terms of pipeline. But, in the health, every single one of our members in healthcare know the following word: travelers. It's not the insurance company. So why is it that travelers, which are essentially substitute nurses, why is it that they make more than the nurses that are connected to a hospital?
They deserve it. Frankly, to cap one person is to cap all of us. The problem isn't our travelers. The problems are the CEOs and the leadership, because they don't want to value the people that have given their blood, sweat, and tears to that organization. The travelers, it's the same kind of concept where, why we have racial disparities and all this stuff. If you pin people against each other, then it's easier to break it down and stay at the top. The problem is never our travelers. The problem is our administration and our leadership not taking care of their business and trying to pin it on somebody else. I'm sorry. Did I take one of y'all's questions?
No.
Okay, I'm sorry.
See what? We wanted this panel. Okay, Joel, what about the pipeline? What do we do?
I mean, we have to invest. We have to invest in our future. And as a concerning thing I see all the time is these, it's not derogatory or anything, but they're brand new baby nurses that come through. I've always been taught, as you come in as a new nurse, and I remember this, it seems like yesterday, 15 years ago when I was a brand new nurse, they would come to me, and my instructors, my mentors would tell me, Joel, okay, you graduated nursing school, that's great. Now you're really gonna start learning, right? And these new students are coming in and don't have the mentorship that they need, the support they need, the mental health they need. Because especially these last 2 years, we went through shit. We went through hell, right?
Yes, we did.
And what happened to these students, or these new nurses, these brand new baby nurses, they got crushed. They had no support. They didn't have the mentorship that they needed and deserved to help them grow, and they leave. I don't blame them, I don't blame them. So we need to invest in them. We need to invest in mentorship, mentors. We need to invest in education. We need to invest in the mental health of these individuals. Or this is gonna be our future. The future that is gonna take care of me and my child, my father, they're leaving. They're not gonna be there. And we just need to invest and support.
So investment and support, which means that all of us, we're gonna get to this resolution on that healthcare staffing shortage, and part of the pipeline issues are part of that resolution. Right. And it means all of us have to invest in our new people coming into the pipeline.
Absolutely.
So this leads me, I know this is just a taste of this, but John Brady, just like there's all these words, travelers, pitting travelers against community nurses, there's all these words around ratios and committees and staffing. Staffing. The human impact is not, what happened in COVID is not sustainable. And of course, we've been advocating for a violence standard, and Joe Courtney, one of our heroes, has been trying to push that as well as Senator Baldwin from Wisconsin. But I really want to hear your perspective on two topics. Staffing. What should we do? Staffing limits, ratios, both? What should we do? And then I'm going to talk to all of you about violence and fatigue and mental health. And we're going to do all of this in the next 6 minutes. Staffing.
Thank you, Randy. So, yeah, both and more. There's nothing wrong with committees other than the fact that they don't necessarily work. They have a purpose. We should have staffing committees. We should have safety committees. They do serve a purpose and they do work as far as a place to discuss things. But in most cases, they don't have teeth. We need that, and we need minimum safe staffing levels, safe patient limit levels. But I think we need one more thing, and this is in the bill that's in Congress that Chair Brown has out. You trust a nurse to titrate medicine. Titrate medicine means you're on an IV drip, and you trust that nurse within certain parameters to speed up the drip or slow it down to keep you alive, to keep you sedated at the right level. You trust the nurse to do that. Why don't we trust nurses to say, or any health professional, to say, this assignment that you're giving to me, because there's too many patients, because my experience level isn't in this discipline, because my experience level is I haven't been around enough years, this is not a safe assignment for my patients. I need less of an assignment. Why is it not that the nurse can say that? And that is in the Sherrod Brown bill. So then when I say X plus, that's what I mean by plus.
Yeah.
So the two other issues, the one other issue I want to deal with, and then I want to ask all of you one very poignant question. What do we do about violence? I think that people don't really know the violence that happens in hospitals now against nurses and healthcare professionals. Okay, people saw what happened in Tulsa. Mm-hmm. But there's violence every single day against healthcare professionals.
Every day. That's always been kind of a major topic for me and kind of something, a passion of mine. I've worked mostly emergency room and trauma. And so we see a lot of violence that comes through there. I've been involved in one active shooter. I've been tased trying to help a police officer that was getting choked out by an inmate at the hospital in the emergency room. My wife recently was in the emergency room admitting a patient, and a psychiatric patient somehow got into the ER with a gun and discharged it, hit the oxygen tank, and thank God it did not blow up. She was 10 feet away, still traumatized, right? We get assaulted by these patients, and administration comes down and tells us, what could you have done different, Joel?
Oh, yes, yes, yes.
What can you have done different I mean, you really should have tried to figure that out with that patient. And excuse me, like, are you goddamn kidding me? You know, it's insulting. Like, there's no accountability for these administrators in the hospital. They're way more concerned about they're less concerned about my safety than the damn Press Ganey score that patient might have, you know? It's horrible. And so what do? I mean, we need laws that say that assaulting a healthcare worker is a felony, in my opinion.
Absolutely.
You know, why are we constantly getting assaulted and getting reprimanded by our administrators that we should attempt something different?
And this is, we get 2 more senators in the Senate and we keep the House. This violence prevention standard in OSHA, we will get enacted in the next 2 years.
Yeah.
So let me ask this. There's a lot of stress in healthcare. All 3 of you are engaged in healthcare every day when you're not here. So what do you do to deal with fatigue and burnout? Each of you. What do you do? And yes, thank you for thanking them.
Go first.
For me, I do weekly chiropractic visits because my back is trash from moving 300+ pound patients without equipment. Put that in there. And massages. Luckily, my particular institution, our insurance pays for a certain portion of that. I like to be at home. COVID, when it hit and we had to stay home, that was right up my alley. I am an introvert by nature. I can function as an extrovert, but I'm okay with being at home. I have an amazing family and a supportive family. My sister's a teacher, my brother-in-law is a teacher, my mom's a retired police officer. So they get it, I get them. But I love my family, I love being at home. You have to pour back into yourself so you can pour back out to others. If we don't take care of ourselves, and I don't care what profession you're in, anything where you're dealing with the public, you have to pour back into yourself. You are nothing. You can do nothing for anyone else if you can't take care of yourself. You have to love yourself. You have to get your mind right, get your body right. You have to take care of you in order to be able to take care of somebody else. So whatever it is that you like, I do not recommend drinking all the time. Let's not do that all the time. Wine is great, but as that being a part of my profession, I do not want to have to see you get a transplant. However, I mean, really find something that's positive, that's uplifting, that pours back into you. If you have a book, go to your favorite coffee shop, get your favorite coffee, go to Starbucks and get those union drinks. Sit on your back patio, go for a walk. That is, it's something else to like clear your mind in a beautiful setting. Go for a walk, do something for you and not take your kids or your helpmate or significant other. No, leave them behind. Do it for yourself and then pour back.
Joel, and then John.
How do I cope? I'm going to be honest. I don't have time to cope. I don't have time to cope. I see my colleagues going through the same thing. The issues they're facing, the constant being understaffed, the constant berating by the administration to, you need this education, you need to do better, you need to do this better for this patient, we're wasting money there. So I guess the way I cope is I try to fight for them and figure out what I could do to make their job a little easier. And I don't want sympathy or anything like that. I mean, that's just, I don't have time because I feel like I have.
Action is the recognizable feature of hope.
Yep, absolutely.
Yeah, well, you know, I'm not at the bedside anymore. I draw a lot of energy from my members. The people, these young people like this and the people in our locals, and I reach out to them and stay connected with them and draw energy off of them in the community groups we're working with, you know. And when we have those small wins, when we push back against those big health corporations, and you know, and when we get some wins against them, that gives me a lot of good feelings and energy.
Like we're going to do against Hartford Health.
Like we're doing, like we did, and I know we're running late. Like we did just the other week against Hartford Health, when after 2 years of fighting to save labor and delivery at Wyndham Hospital, the state stood with us and against Hartford Health.
Exactly right. And I see the Connecticut folks standing up. So look, these two panels were just a taste of who you are and who the communities you represent and serve are. So I just want to say thank you, January, thank you. Joel, thank you.
Thank you.
John, thank you. Our nurses and healthcare professionals, they need our support. We need them, and they need our support. Thank you. That was amazing. You were amazing. Thank you. And thank you for that answer, Travis.